Menopause is natural, but do you know what else is natural? It's the changes that happens to your pelvic floor that nobody told you about. Have you ever thought, why am I leaking urine during menopause? Why does sex feel painful? Why does intimacy feel different now? What is the sensation of fullness and heaviness that's coming from down there? If you're feeling any of these symptoms, you're not alone. And in today's video, we're going to be talking about everything that changes in your pelvic floor after menopause. Hi everyone, I'm Dr. Nabila Noor, a board-certified urogynecologist and a pelvic reconstructive surgeon, and welcome back to my channel. In this channel, we talk about everything pelvic health. There's no taboo, there's no shame, only information, science, and a community that's supportive where we learn together and share each other's stories. If you're new to the channel and like what you see, please subscribe to the channel so it helps us grow and more people can find out about us. So let's get started. First things first, let's start with what is the pelvic floor. So the pelvic floor is a group of muscles and a combination of ligaments and connective tissues that essentially forms the base of your torso. And these pelvic floor muscles are supporting all your pelvic organs, which could be the uterus, which is where baby grows. It could be the bladder that holds your urine. It could be the rectum and the intestines that collect stool. So all these organs are supported with the pelvic floor. Now, what happens to your pelvic floor during menopause? So menopause is when the estrogen levels in our bodies drop. Now, estrogen is a very important hormone for females. What the estrogen does is it helps restore the pelvic health strength. It keeps it hydrated, it keeps it strong, and it keeps it elastic. So when the estrogen drops in menopause, which for most women is the average age of 51, the pelvic floor starts to change. So what are some of these changes? Number one is muscle weakness. As the estrogen drops, those pelvic floor muscles that used to be strong start to get weak and thin, which make it harder for them to support those pelvic organs. Number two, vaginal dryness and irritation. As the vaginal tissue starts getting more thin and drier, it becomes more and more uncomfortable with intimacy. A lot of women will complain of even bleeding with intimacy and feeling like something sharp is cutting at them, almost like razor blades. And many women will often complain of getting tears in the vaginal area as well as developing infections. Number three, bladder changes. Many women start complaining of urinary symptoms, things like urinary urgency, where they feel like they cannot control the urine anymore, or having to run to the bathroom multiple times every few hours, waking up at night multiple times to go to the bathroom, and oftentimes having leakage of urine and not being able to control it. Number four, recurrent urinary tract infections. Because of the drop in estrogen, there are changes that happens to the vaginal microbiome, and as a result, there's a decrease in the number of good bacteria that helps prevent women from developing these infections. And number five, prolapse risk. Remember, we talked about the pelvic floor muscle being the support of the pelvic organs. So when the support is not working as well, those pelvic organs, which could be the uterus, the bladder, the rectum, the intestines, are trying to push through the vaginal wall. And that's what we call pelvic organ prolapse. So what are some symptoms you should be looking out for? Symptoms of heaviness, pressure, feeling of bulge coming down vaginally, a lot of irritation, and even vaginal bleeding with intimacy or penetration, getting a lot of infections. Every now and then, if you get an infection once or twice a year, that's fine. But if you're getting 2 or more urinary tract infections in a period of 6 months, or 3 or more infections in a period of 1 year, that is known as recurrent urinary tract infections. Vaginal dryness, burning, pain, running to the bathroom all the time. These are symptoms of urinary urgency, frequency, nocturia, where you're waking up at night. These symptoms are all signs that your pelvic floor is being affected as a result of your menopause. But here's the good news. There are solutions, so you don't have to suffer in silence. Let's talk about them. Number one, using vaginal estrogen to help improve the vaginal tissue quality as well as restore the good bacteria. So vaginal estrogen is a very simple and a very safe form of treatment. It's very easy to use, very cheap. And what I recommend for my patients is to start using the vaginal estrogen cream almost like a moisturizer to help improve the strength of the pelvic floor muscles, the integrity of the vaginal tissue, and also improve the good bacteria in the vaginal area that can help prevent infections. Number 2, in addition to vaginal estrogen, you can also use hormone replacement therapy, especially when you're going through the transition of perimenopause to menopause. Remember, hormone replacement therapy is an oral hormone that we prescribe patients, whereas vaginal estrogen is applied locally. I have many patients who take both because the oral hormones are for systemic symptoms that patients complain of, whether it be the hot flashes, the mood swings, the brain fog. And just because you're taking the hormone replacement therapy doesn't mean you cannot take the vaginal estrogen and vice versa. Now, in addition to the hormonal treatments, there are also non-hormonal treatments that we often talk to patients about. Vaginal moisturizers, even coconut oil, which a lot of people really like. It's a natural substance. It can act as a natural lubricant. And also for those of you who are suffering with pain with intimacy, adding an additional lubricant, preferably a silicone-based lubricant, can really make intimacy easier. Number 3, lifestyle modifications. Increase your fiber intake. 30 to 30 grams of fibers every day, along with appropriate hydration so you can avoid constipation. Try to control your weight. And a lot of the times it doesn't have to be anything drastic. Just watching what you're eating, increasing your protein intake, daily activities, whether it be walking or strength training, any form of movement. These little lifestyle changes can go a long way. Number 4, working or consulting with a pelvic floor physical therapist, especially if you're not sure how to exercise those pelvic floor muscles so you can strengthen it. I have many patients who work with pelvic floor physical therapists, and they can really kind of try to help individualize the pelvic floor exercise regimen for you. Because remember, it's not just doing your Kegel exercises. Kegel exercises are important, but that's not the only thing you should be focusing on. In addition to the Kegel exercises, you should also be focusing on increasing your core strength, your ab strength, your glute strength, your hip stretches, your alignment, your breathing techniques. All these can be really individualized for you by working with a good pelvic floor physical therapist. Number 5, don't be afraid to see a urogynecologist, and if needed, discuss minimally invasive surgical techniques. I have many patients who have tried a lot of the conservative measures and still suffering with all these issues. And guess what? There are many procedures that we can do to help you improve your quality of life. Depending on your condition, there are procedures that are same day, and they range in time from 15 minutes to at most 2 hours, but there are options. So if you feel that you've tried all the conservative route but things are not improving, get yourself an appointment to see a urogynecologist who is trained and can talk to you about all the options so you can make the best decision for yourself. So as we learned, menopause doesn't just mean hot flashes and mood swings. There is so much more, and there's this whole aspect of the pelvic health that truthfully many women may not know about. This is why it's so important for me as a urogynecologist to talk to you about the pelvic floor changes that happens, because I want you to know your body, I want you to know what your options are, and I want you to have the ability to make the best decision for yourself. Hope you found this video helpful, and if you did, don't forget to subscribe, and please share it with others. Share it with your girlfriend, with your family members, with your loved ones. We need to talk about these topics more and more without any shame, without any taboo. So don't forget to tune in, and I'll see you then. And I also have a newsletter that I send out every week. So if you want to get more pelvic health tips right in your mailbox, then click the link in my bio and sign up for the newsletter for weekly pelvic health tips that's science-backed and evidence-based.